guys, I'm back. It's been a really long time since I have recorded anything. Basically, I got pregnant and then got really, really sick and totally gave up on the idea of doing any sort of a vlog or update or whatever. Not a vlog. So I guess this is my 6 to 15 week update on being pregnant with baby number 2. But also I'm going to tell you about some of the crazy medical complications I've had since becoming pregnant. So pretty much the nausea started really early, as I said in my last vlog. And pretty much everything that I said was helping with the nausea, I don't know if I even showed these, ginger chews, Preggy drops. I had all sorts of different things that I was doing that were like, oh, this is going to be great. Well, none of those worked. In fact, all of those ended up making me more nauseous. I ended up getting really, really, really bad, burning in my stomach. This on one side, and I couldn't keep food down. I was throwing up nonstop, at least 10 times a day. I had started taking Tums, and Tums didn't work. And I ended up going to, I have a hair on my nose that's itching. I ended up going to urgent care one day because this burning in my stomach was so bad and I couldn't keep food down. It was awful. I think I had morning sickness, and then I was convinced I had a stomach ulcer. And I went, and they actually said, you need to go to the hospital. And I didn't go because I knew that it wasn't something so serious that I needed to go to the hospital. But I got in contact with my gynecologist, or my OB, and she said you can take Pepcid. So I was like, great, this will be stronger. It's just like an acid reducer. So I went on that, and for a long time I was on that, and they also had prescribed me, I wanted to do an all-natural pregnancy this time. I pretty much did last time as well. But I ended up taking Unisom at night along with vitamin B to try to help with nausea because I was so sick I couldn't get out of bed. I was taking Pepcid, Tums, so I really didn't want to be taking any medicine this pregnancy, but I was so sick I had no choice. I had to stay alive. So I was sick for weeks and weeks and weeks, and at about 13 weeks, maybe 12 weeks, I'm 15 weeks now, I had absolutely lost it. I was in so much pain, this burning in my stomach, I just could not handle it anymore. I went to the doctor and I just demanded they figure out what it is. And they kept saying, oh, it's acid reflux, it's just acid reflux, it's regular during pregnancy. And I was like, no, listen, I've had acid reflux when I was pregnant with Felix. I had it really badly. And I was like, this is so different. So they tested me, and it turns out I have a stomach ulcer, and I tested positive for H. pylori, which is a bacteria that's in your stomach. And if it gets out of control, or if you have an ulcer or something, it can become very, very serious. So I had to go on, and meanwhile I was on even stronger acid reducers that are not recommended during pregnancy, but you have to treat the symptoms sometimes. So I was very unhappy about that. And then on top of that, I had to take 2 antibiotics, and then a lot of acid reducers twice a day, which is not great. But I was really happy to be figure out what it was. I was taking it, and then I had a reaction to the antibiotics and became very allergic. So instead of taking me off them, which is worse in a way, I then started taking Benadryl and Zyrtec, one in the morning, one at night, to try to combat the allergic reaction I had, hives everywhere. I was really, really itchy. So anyways, I'm feeling much better now. I'm 15 weeks now. It's been a really, really rough pregnancy. I'm not throwing up nearly as much as I was. Occasionally I'll throw up here and there, but I'm so much better. Sorry, I have the hiccups. Most of you probably don't care about hearing those kind of details because that's not the norm of being pregnant. I feel a lot of people just have the regular morning sickness or morning sickness that lasts 16 weeks or whatever. I'm really hoping mine goes away. I still have it on and off throughout the day. I still have morning sickness on and off throughout the day, but it's so improved. It's very bearable. Still have a lot of acid reflux now in my chest, but I'm taking an acid reducer and I'm just staying away from everything that could potentially aggravate it. So like chocolate, lemon, pineapple, tomato, vinegar, coffee, but it doesn't actually seem to help that much, but I'm just doing that to try to, you know. So yeah, pregnancy has been really rough this time. I'm still so excited that I'm pregnant, that it happened for me. Felix is starting to like know what's going on. He's really excited. We had now 2 ultrasounds. And at my last appointment, we got to see the baby again, just in like that little like handheld thing they have in the doctor's office. We did go ahead and do the genetic testing, which tests for like chromosomal disorders and then also for things that you could be a carrier. We had to do the carrier testing. So the chromosome test came back normal. They didn't see anything that could, you know, that was alarming. Of course, it's not 100%, but based on that, they didn't think any further testing was necessary. And then for the carrier testing, I think they test you for like 100 and something, I don't know, 170 things that you could possibly be a carrier for. And I came back, actually, I didn't do this when I was pregnant with Felix, but I came back as a carrier for 1, and I forget the syndrome it was. So this last week, Daniel got his blood taken it's only really concerning if your partner is also a carrier for the same genetic disorder or whatever, syndrome. So we're still waiting back for the results of that. So that's always like a little bit nerve-wracking, and I don't like that. But we will find out soon, and hopefully he's not a carrier. If he were to be a carrier, there's further testing that they do, but it's much more invasive, and there is a chance of miscarrying as a result of the testing, but I think it's a pretty low chance, relatively low. But yeah, so I guess this isn't really like a good pregnancy update because it's not, again, not the norm. I'm starting to show already like a lot because I think I have really weak ab muscles, and also I carry a lot of fat on my stomach naturally. So when I have any sort of bloating or any sort of pushing out of that area, like everything looks bigger because there's already a couple inches of fat there. And also I just kind of like, I'm not trying to suck in or anything because it's like I'm pregnant, I can just, you know. So yeah, I'm at 15 weeks, I feel like, or 14 weeks, you start to feel everything really start to stretch, and like you feel your hips start to like widen. Everything just feels like achy down there. So I'm definitely experiencing that. I'm getting the nasal congestion, which is, I know in like second trimester is like the thing that like starts happening, and like nosebleeds. I've gotten like some very mild ones. But I remember when I was pregnant with Felix, I got some very, very bad nosebleeds. Hopefully be doing updates a little bit more often. I had really hoped to do them more often, but life just didn't, it didn't work out that way. So yeah, hopefully people keep watching, and yeah, I'm enjoying doing this. So see you guys soon. Bye.